Gout is a chronic inflammatory arthritis. This is different from rheumatoid because rheumatoid was what caused autoimmune, right? Attacking the joints. Gout is a form of arthritis caused by increased uric acid levels. Okay. Now there's two ways we can have this. There's primary and secondary gout. Primary gout so primary gout or primary hyperuricemia caused by what? Severe dieting or starvation. It's excessive intake of high purine foods such as shellfish, crabs, shrimps, other crustaceans, lobsters. What else have shells? Yeah, clams, right? So the shellfish have high purine. Primary gout or primary hyperuricemia is also hereditary, meaning your body just synthesizes a lot of uric acid, meaning your body is structured in a way which is genetic that you just make a lot of purine, a lot of uric acid, no matter your diet. So it's not always caused by diet. So these are the primary type of gout. The secondary type, what's the cause here? Can be genetic or can be caused by another condition. For example, cancer or leukemia. Okay, so anytime you have a condition that causes death of cells, for instance, when you learn more about this when we talk about cancer next semester. So when you have people with cancer receiving cancer treatment, what are the chemo drugs, radiation doing to the cancer cells, Faith? Killing and destroying them. And what do cells, normal or cancerous cells, contain when they die? Uric acid. And they also have high potassium. Okay, so they will spill potassium. So one of the causes of secondary gout is cancer or cancer treatment. Okay. Yeah, secondary. So primary is from your diet or from your hereditary. Okay, that's just how you're made. Okay, so just unfortunate that that's how your body processes uric acid. Now let's go to the symptoms now. Patient alcohol, by the way, also has high purine. Meat, here red meat. What are considered red meat? So who's fond of what culture or ethnicity or religion eats a lot of red meat? Who are Muslims here? Muslims don't eat pork. So what do they eat? A lot of it. Okay. So especially when they have, let's say at the end of Ramadan, for instance, okay, at the end of the fasting, when they have these big feasts, okay, they're celebrating, they have a lot of beef. Okay. So the next day, what happens? These patients get the tophi right here. So these are very painful accumulations of uric acid crystals. They go to the bottom of the body, which is the toes. So the toes are so swollen, inflamed, painful that they can't bear anything on it. Meaning even just a thin sheet or a feather touching it is making it very tender. That's how painful it is. So they can't walk. Right. So my regular mechanic is Muslim. I've had him for 15 years now. So that's what happens. Okay, and he never learns. I mean, you can't stop celebrations, right? So when I call him, I know not to go after Ramadan because I know he's gonna have an attack. Okay, so he's not gonna open the shop. So, but I call anyway, just making sure, sometimes, I need some car repairs and I'll call him, hey, Mr. Sun, what's up? He said, yeah, my friend, not today, my friend, celebration yesterday. Oh, okay, I know what you mean. Okay. But he already knows the treatment. Let's go to the treatment. So very pain, here are the complete manifestations here. Pain is the number one. So the tophi again makes the big toe really red and swollen. Extremely painful. Can't wear shoes. They can wear flip-flops, but again, they can't bear any weight on the toe. Management is medications. Now let's make sure we understand the treatment here. For patients with primary gout, meaning they will have it all their life, correct? Because it's either from their diet or from their body, right? It's hereditary. So that's primary gout. So if they have primary hyperuricemia, they will be put on allopurinol. Here, xanthine oxidase inhibitors, allopurinol, or febuxostat are the maintenance medications, meaning they'll take this every day. Are we clear? You understand? So this is their maintenance medication because they have what? What type? Primary gout. Okay, so they'll be put on allopurinol. And of course, diet modification. And what else do they avoid? Alcohol, right? Yeah. And what else? Red meat. Okay. And of course, the shellfish. Okay. Now, for acute attacks, because can you stop these patients from living? Of course, they'll enjoy life. Okay. So there's parties here and there. So, of course, they'll enjoy. Okay. They'll indulge. Nothing wrong with that. So, they'll have acute attacks. So, acute attacks are managed how? Can they still continue with allopurinol? Too late. I mean, they're already taking it every day. Now they have an acute attack. So extra high uric acid levels. Allopurinol will not work. We will use something else. Colchicine. Colchicine is used when? Acute attacks only. Only for a limited time though. The longest you can take this is a few days, or maybe the longest would be 2 weeks, which is pushing it. It should only be taken for a few days because it's very toxic to the kidneys. Why is it only taken for a few days? For a short period? Highly nephrotoxic. So because it's nephrotoxic, when they are taking it, what's your best advice? Take it with full glass of water to help eliminate the drug in the kidneys. Clear? All right. Colchicine, or you can use NSAIDs. The NSAIDs here are specific. The NSAID is indomethacin. You can probably use ibuprofen, but it won't be as effective as indomethacin. Okay? Or they'll be put on steroids. That's how bad the inflammation and pain is. Right? So non-pharmacologic, of course, change your diet, avoid those foods. It'll help with weight loss will help. Avoid or decrease alcohol. What medications can trigger uric acid? Okay, these are the medications. So we've got, there were diuretics mentioned here, right? Thiazide. Okay. So thiazide diuretics must be avoided. And already, aspirin also, salicylates. So aspirin and diuretics can trigger attacks. Any questions? All right. All right, if we have patients that are refractory, meaning don't respond to any of these treatments. There's a last resort here. Here in refractory, refractory means unresponsive to the treatment, usual treatment. We will include pegloticase. So this is an IV medication. All right. Now, the number one warning for this is this tends to, not in all people, but some patients have had a anaphylactic reaction to this drug, right? So therefore, since that's the concern, can this be administered at home if it's known to cause anaphylaxis? Can you safely give this at home? No way. It should only be given, therefore, in a hospital setting. All right. Any questions? So the drugs here, these are drugs, colchicine, probenecid, allopurinol. So what am I testing? What questions am I gonna ask? It's a drug. Signs, symptoms, what signs and symptoms? There are signs and symptoms of a medication. Side effects. All right, so you have here, the answers are right here.